Welcome to PT Microlessons, fast lessons with big impact. In this lesson, we're going to cover EKG basics, with a focus on what you actually need to know as a physical therapist. The goal isn't to turn you into a cardiologist, but to help you recognize normal and abnormal rhythms so you can make safe and effective clinical decisions. So let's get started. Let's start with why this is important. Even though physical therapists do not diagnose arrhythmias, we do need to recognize them. First and most importantly, this is about safety. Many arrhythmias can reduce cardiac output or lead to serious events during activity. We're also responsible for monitoring patients' responses to movement and exercise. If something doesn't look right, we need to recognize it. That directly impacts our clinical decision making, whether to continue, modify, or stop treatment in real time. We also play an important role in communicating these findings to the healthcare team. And remember, most cardiac testing is done at rest. As PTs, we assess patients during movement, which puts us in a unique position to identify problems that may not otherwise show up. Next, let's define what an arrhythmia is. An arrhythmia is an abnormal heart rate or rhythm, also called a dysrhythmia. These abnormalities can range from relatively benign to life-threatening, depending on how they affect the heart's ability to pump effectively. Arrhythmias can be evaluated using different tests of the heart's electrical system. In some cases, more advanced and invasive testing, such as the electrophysiological study shown here, can further evaluate the heart's electrical system and help identify or treat abnormal electrical signals. However, arrhythmias are most commonly diagnosed using electrocardiography, which records the heart's electrical activity and produces a tracing called an electrocardiogram. Because EKGs are non-invasive, widely available, and commonly used in clinical practice, we'll spend most of our time here. An electrocardiogram, also called an EKG or ECG, is a tracing that shows the heart's electrical activity. It uses a standardized system of electrode placement on the body, allowing for consistent and reliable measurements. As a result, it produces predictable, recognizable waveform patterns. These patterns help us identify normal rhythm, and more importantly, detect abnormalities. In clinical practice, there are different EKG setups, including 3-lead, 5-lead, and 12-lead. 3-lead and 5-lead are commonly used for cardiac monitoring in hospital settings. For this lesson, we will focus on the 12-lead EKG because it is more comprehensive and commonly used for diagnostic interpretation. A 12-lead EKG gives us a more complete picture of the heart. Although it's called a 12-lead EKG, it actually uses 10 electrodes placed on the body. 6 of these are chest or precordial electrodes, which provide a horizontal view of the heart. The other 4 are limb electrodes, which provide views in the frontal plane. Together, these electrodes generate 12 distinct views of the heart's electrical activity. This helps clinicians create a more complete picture of what's happening across different regions of the heart. Next, we need to examine how those 10 electrodes produce 12 distinct views of the heart. As you can see, the chest leads, shown in yellow, provide a view of the heart in the horizontal plane, represented by arrows coming out of the screen toward your nose. The limb electrodes, shown in green, provide views in the frontal plane, moving toward the ceiling, floor, and walls. Together, these electrodes create 12 distinct views of the heart's electrical activity. Although there are only 4 limb electrodes, they generate 6 limb leads. This occurs because the EKG machine compares electrical differences between electrodes and, using basic electrical principles, calculates multiple viewing angles. So through a combination of direct measurements and calculated leads, we get a more complete picture of what's happening across different regions of the heart. Now, this is what a 12-lead EKG actually looks like. Each of these tracings represents a different lead or view of the heart's electrical activity. Even though it's the same heartbeat, each lead is looking at it from a different angle. When you put all of these views together, it gives you a more complete picture of what's happening across the heart, almost like building a three-dimensional understanding from multiple perspectives. It's also helpful to know that some leads are used more often than others. 2 leads will probably seem the most familiar, lead 2 and V5. That's because these are commonly used in monitoring systems and bedside cardiac monitoring. So many clinicians recognize these views first. As we move forward, remember that each lead is simply a different angle or perspective of the same electrical event. Okay, let's wrap up. In this lesson, we covered the basics of EKG interpretation. Remember, an EKG is a recording of the heart's electrical activity. As shown in this picture, you can think of each lead as looking at the same object from different camera angles. In the same way, different leads provide different views, angles, or perspectives of the same heartbeat. That's why a 12-lead EKG is so useful for diagnostic interpretation. It gives clinicians multiple views of the same electrical event. Although each lead views the heart from a different angle, they all capture the same electrical cycle.
That's it for this PT Microlesson. Like and follow at PT Microlessons for more fast lessons with big impact on physical therapy topics.